Hello, my name is Ermin Kreso and I'm a specialist of internal medicine. I will be talking to you today about my involvement as the medical director of the ImmunoKit laboratories. As you have already seen the presentation by Tamia Sisko, she has explained the nature of the program. What I want to educate you about today is the medical and psychological impacts of addiction and how my involvement with the company fits in. So, as you are aware, addiction is a multifaceted, currently incurable but treatable problem. What I do as a physician, a specialist of internal medicine, either at my clinic called Mile High Internal Medicine and Urgent Care, or at the premises of the ImmunoKit laboratories, is perform a medical physical examination as well as a psychological assessment of the patients who will be entering into the program. The things we screen for in the psychiatric domain include depression, bipolar disorder, psychotic disorder, various anxiety disorders that might be a part and related to the patient's addiction and abuse disorder. What we screen for the organic disease is heart disease, lung disease, involvement of the pancreas, the liver, the kidneys, as well as other metabolic derangements. As again you are aware, the current state of addiction in the United States is quite troubling. There is a tendency for a lot of physicians to prescribe medications of abuse and addiction potential to patients for conditions that might be better treated with other modalities. An example of this phenomenon is the current outbreak of adult-onset attention deficit disorder, which many physicians choose to treat with Adderall as well as other stimulants. What we are actually seeing is an outbreak of adult-onset anxiety disorders. And one way we can tell that the diagnosis in this case might be wrong is the patients to whom Adderall is prescribed are having to take benzodiazepines to calm down after their stimulant effect kicks in. So that is one of the things that we see as a very common problem that might lead to addiction to stimulants. Next thing is obviously the addiction to benzodiazepines, because so many people in the United States these days suffer from stressors that stem from hard working conditions, family dysfunctions, financial difficulties, as well as problems with their physical and emotional health. The first impetus by many physicians is to prescribe benzodiazepines. We all know of the addiction potential of those. Again, there's wonderful modalities for treatment of anxiety that do not involve those medications as the first-line agent. So what we do in the clinic is assess whether the patient suffers from a primary psychological or psychiatric disorder in addition to their substance abuse. Physically, what happens with many types of substance abuse, such as alcoholism, is that many types of organ damage can ensue. For example, we see people with cardiomyopathies, heart disease. We see people who have developed profound liver disease or kidney disease. And these are the things that we screen for. We will perform a routine screening electrocardiogram, as well as a panel of blood work that tests for various organ and metabolic dysfunctions. It is my pleasure to be talking with you today. I hope that this quick but educational presentation was useful to you, and please feel free to contact us with any questions and follow-up. Thank you again.